I'd like to speak today on reforming our healthcare system. Simply put, healthcare reform has been delayed for far too long, and it cannot wait any longer. Most Americans are satisfied with the health care they receive today. Let me repeat this. Most Americans are satisfied with the health care they receive today. But if we want to sustain and improve the quality of affordable health care, we need to act now. What they're concerned about is what the future health care is going to be about. And they're also concerned about the cost of health care. We must get health care costs under control while preserving choice. If we do nothing and allow the status quo to persist, it has been estimated that the share of gross domestic product devoted to health care will rise from 18% in 2009 to 28% in 2030. If health care premiums continue to rise at 4% per year, which is actually less than the historical average, that by 2025, premiums for family coverage will reach $25,200 per year, over $2,000 a month. This trajectory is simply unsustainable. We have attempted to reform our healthcare system several times in the past to no avail, but this year is different and has got to be different. This time, the call for reform is coming from people and organizations that previously opposed reform. This time, businesses along with unions that represent their workers are asking for reform. Businesses here in America have to compete against companies from other countries. Many of them do not pay anything for health care for their workers or retirees. Others pay far less than what many of our larger corporations pay. This puts many of our businesses at a disadvantage in the global marketplace. In addition, people in my home state of Delaware and Americans across the nation are struggling to keep up with a crushing and seemingly constant increase in the cost of health care. Over the last decade, Americans have watched as their health insurance premiums and deductibles have risen at much faster rates than their wages, threatening their financial stability. It also puts them at risk for losing their insurance as employers struggle to provide adequate health care coverage. Americans rightfully value their relationship with their doctor and the care they receive. We must, and I say must, preserve these relationships. In addition, as costs rise and insurance benefits erode, Americans are also asking for reform that protects what works and fixes what's broken. Our current healthcare system, the status quo, is rampant with bureaucracy, inefficiency, and waste. It is time for reform. It's time to reform health care for Americans so that everyone has access to quality, affordable care, regardless of pre-existing medical condition. It is time to reform health care so we place a higher priority on prevention and wellness, saving lives as well as money. It is time to reform health care so all Americans can compare the costs and benefits of different health care policy. It is time to reform health care so Americans have more choices, not less, and can choose their own doctor. I applaud the members of the Finance Committee and the Health, Education, Labor, and Pensions Committee here in the Senate, as well as their counterparts in the House, for their sincere dedication, their thoroughness, and their commitment to crafting legislation that truly transform the healthcare system in this country. It is clear this is not an easy task, and is one that will require true compromise from everyone across the ideological spectrum, but is a task that must be done. Our country and the health of its citizens, as well as the economy, cannot afford to maintain the status quo. As a member of these committees gather to discuss and ultimately mark up legislation, I encourage them to include a viable public option in a menu of insurance options from which Americans may choose. It would be a, let me stress this, it would be a purely voluntary option. If you like your current plan, you keep it. But a public health insurance option is critical to ensure the greatest amount of choice possible for consumers. There are too many Americans that do not have real choices when it comes to health insurance, especially those who live in rural areas. In addition, many large urban areas are dominated by one or two insurers that serve more than 60% of the market. In fact, there are 7 states where one insurer has over 75% of the market share. A public option can help Americans expand their choice of insurance provider. A public auction could take various forms, and I think the committees are the proper place to determine the appropriate contours of a public option. But I think a good starting point for discussion is the proposal put forward by my colleague from New York, Senator Schumer. It delivers all the benefits of increased competition without relying on unfair built-in advantages for the federally backed option. This public option would not be subsidized by the government or partnered by Medicare. It would not be supported by tax revenue. It would compete on a level playing field with the private insurance industry. And if a level playing field exists, then private insurers will have to compete based on quality of care and pricing instead of just competing for the healthiest consumers. This is just one proposal for a public option. There are others that we can debate as we move forward. Right now, more than 30 state governments offer their employees a choice between traditional private insurance and a plan that is self-insured by the state. Some of them have them for more than 15 years. In these states, the market share of the self-funded plans within the market for state employees typically ranges from 25 to 40%. This shows a healthy competition between the public option and the private insurers, not domination by either type of insurer. The states provide these options because they believe it adds value to their competitive offerings they give their workers. These arrangements do not seem to be a problem or incite ideological issues at the federal level. Why should it be so when discussing health reform at a national level? A public option go a long way in introducing quality advancements and innovation that many private insurers do not now have the incentive to implement. Medicare and the Veterans Health System have spearheaded important innovations in the past, including payments methods, quality of care initiatives, and information technology advancements. A new public option could also help lead the way in bringing more innovation to the delivery system and introducing new measures to reduce costs and improve quality. A public option would serve as a benchmark for all insurers, setting a standard for cost, quality, and access within regional and national marketplaces. It can have low administrative costs and can have a broad choice for providers. Simply put, Americans should have the choice of a public health insurance option operating alongside private plans. A public option will give Americans a better range of choices, make the healthcare market more competitive, and keep insurance companies honest. The key to all this, however, is that a public option will be just that. As I said before, an option, not a mandate. Some people will choose it, others will not. If you like the insurance plan you have now, you keep it. If you're happy with the insurance you get from your employer, or even the individual insurance market, or even you may be stay enrolled in that insurance plan. And if you're unsatisfied with the public option, you have the option to switch back to private insurers. Americans firmly support the ability to choose their own doctor and value their relationship with their providers, and so do I. An overriding goal of health reform is to increase patients' access to affordable, quality health care, and offering a public option can help increase America's choices. I am heartened that I was joined by 26 other senators several weeks ago in co-sponsoring a resolution sponsored by Senator Brown calling for the inclusion of a federally backed health insurance option in health care reform. Senators who have been involved in health care issues for decades, Senators Kennedy, Dodd, Rockefeller, Harkin, Bingaman, and Inouye, just to name a few, have all agreed that a public option should be included. As I said before, I admire the efforts of my colleagues on Finance and Health, Education, Labor, and Pensions Committee who will be drafting our health reform legislation. They have an important responsibility, and I recognize they will be debating many, many options regarding coverage, financing, regulations, and so on. I simply encourage that to consider seriously a public option as a choice for Americans in any new health insurance exchange. Thank you, Mr. President. I yield the floor and suggest the absence of a quorum.